Hello, and welcome to my presentation on sexual addiction. So to begin, we're going to discuss the variety of definitions that I found while researching this topic. The most common is compulsive sexual addiction, which is described as a repetitive and intense preoccupation with sexual fantasies, urges, and behaviors leading to adverse consequences and clinically significant distress or impaired social, occupational, or other important areas of functioning. This is described as being presented as either individual-based behaviors, such as an addiction to pornography, masturbation, or sexual fantasies, or it can be presented as partner-based behaviors. The second definition I found was the only officially endorsed definition of a sexual addiction, and can be found in the World Health Organization's definitions of disorders. They define this as a compulsive sexual behavior disorder with persistent patterns of failure to control sexual impulses, resulting in repetitive sexual behavior pursued despite adverse consequences. This is noticeably listed as an impulse control disorder and is distinctively not an addiction in the World Health Organization's list of diseases. The third definition I have here is the hypersexual disorder, which lasts over a period of at least 6 months, recurrent and intense sexual fantasies, sexual urges, and sexual behaviors. This is in the DSM-5, however, it is notably under a section dedicated to conditions requiring further research. So why is sexual addiction not in the DSM? There is a clear lack of evidence for this disorder as an in-depth pathology, a risk of misdiagnosing clients because of clinicians' own biases on cultural values, sexual orientation, and religiosity. And there are 5 current explanatory models for why someone might develop this disorder. We've got the the obsessive compulsive model, the impulsive control model, the out of control model, the addiction model, and the biopsychosocial model. Because of all these different explanatory models, there are different treatment options that are still being explored and tested, which is why it's not in the DSM. So why is sexual compulsive disorder occasionally described as an addiction? Well, there are similarities with other addictions, such as a craving state prior to behavioral engagement, impaired control over behavioral addiction, continued behavioral engagement despite negative consequences, frequent preoccupation with sexual behavior, and repeated unsuccessful attempts to stop. While researching, I came across 7 different types of treatment options. There is the cognitive behavioral therapy option, mindfulness, Gestalt therapy, task-oriented approach programs, out of control sexual behavior treatment protocol, and psychotherapeutic stage, as well as group therapy. For the sake of time, I will be focusing on my favorite treatment option that I researched, as well as my least favorite treatment option. So my favorite option that I came across is the task-oriented approach program. This is divided into 4 years, which I think is a really realistic way to break any cycles of behavior. So the first year encourages patients to break isolation, survive withdrawal symptoms, reduce shame, work through their emotions, and resolve crisis situations. The second and third year of this program are described as the rebuilding stage and encourage patients to build relationships, experience celibacy, develop self-affirmation, change one's lifestyle, develop a relapse prevention plan, find alternatives, and find spirituality. The 4th year of this program, I really appreciate because it allows patients to reintroduce sex into their life in a healthier, more realistic way. So there's further behavioral changes, such as having a healthy sex life and having healthy relationships with family and friends. So my least favorite option that I came across is the group therapy option, which is most commonly known as Sex Addicts Anonymous or Sex and Love Addicts Anonymous. This is probably the form that you are most common with. I think it has a high prevalence in media. to be described as the recommended program. And it's for that reason too, it is also highly recommended in mainstream. It follows the same 12-step program that AA and NA follows. However, there are a lot of arguments against this program. So there's not any evidence to support that it is effective. There's a commitment to abstinence that is unrealistic. And when patients, quote unquote, relapse, they are then approaching having sex again with a lot of shame and judgment, which not a healthy way to reinvent sex or to reintroduce sex into your life. There's also a very serious religious sexual bias. The Sex Addicts Anonymous book, published in 2005, lists many fine sexual behaviors as addictive and unhealthy. There's not a lot of room for sex positivity in this form. And there's no mention of how to measure unhealthy sexual behavior. It just kind of lists a lot of sexual behaviors that are not necessarily traditional, but are not necessarily unhealthy either. So yeah, I had a lot of problems with this one. I hope you guys enjoyed my very brief explanation of sex addiction. Here are the references that I used to create this presentation. And thank you so much. I hope you have a great day.